it on my Facebook.
Yep. Hold on.
Okay.
Let me go to my, there we go. So it's opening up my Facebook now. And choose where to share. Hold on. I'm choosing where to share, so give me a second. That's where I'll share it to your page.
Okay.
For some reason, my finger's being ultra sensitive. Here we go. It should be in
Huh?
a couple of seconds to be live.
I'll turn my music up a little bit.
And we should be live, or it says still preparing. So give me a second. Let me check your page and see if it came through yet.
Not yet.
Okay. For some reason, I don't know if it's the internet or what. All right, can y'all check and look on my mom's page and see if you see it up there? It's still on Facebook. Yeah.
Yeah.
Oh, I just heard something come on. Let's see if that's it. No, not yet.
Yes, saying preparing. So we are recording now. Hold on, let me go. Oh, hold on, I found it. Not sure why my thing is circling.
These are machines subject to fail.
Technology.
Yeah.
Internet is unstable. So let me.
Not on there yet.
Okay. Yeah, my internet is like going really slow.
Maybe because you're on a different spot tonight, you think?
Okay. Let's see.
They said they can't find it. I'm getting all kind of texts. Meeting is now
Okay,
streaming
it's
live.
going to it now.
Yay! It's coming on. Somebody in Texas just text.
Redirect.
Oh, okay.
Are we ready?
We should be good to go. We're live, guys. Yes, we are ready.
We're live?
Yes, you're good to
All
go.
right, all right.
Yep,
Come
we're
on
live.
in, everybody. We are live. Although I don't have it on my page, but we are live. Ooh. All right, we're streaming live now, Facebook. Let's talk about it. It's on tonight. Live conversations. We're excited. So much is going to go on tonight. We've got guests tonight, and I'm so excited about that. But tonight, to vaccinate or not to vaccinate, that's the question. So we want you to join in this conversation. We've got, wow, I can't even think about what the conversation is going to be like because it's powerful. This is something that everybody is thinking about. So I'm excited to have tonight with us Dr. Michelle Webb. She's going to share a little bit. We have also Isabella Pena, who is a retired military nurse. Excited about that. And of course, my co-host Terry and Shawana. We're so excited. If you're joining with us for the first time, my name is Alice Jackson, and I am hosting this Let's Talk About It. This is our third week. And so we're so excited to just begin with these great conversations. And this is one that everybody talking about right now. And that is to vaccinate or not to vaccinate. That is the question tonight. So let's just get started. As you come in, we want you to share with us in the comments. You can, post your questions or your thoughts. And that's what it's all about. It is just conversation. Just imagine yourself sitting around the kitchen table and having tea or coffee, and you're just talking about different conversations. This is one that is at everybody's table right now. That's COVID-19 vaccine starting tomorrow. So we want to talk about it this afternoon. So let's get started. Ladies, let's jump right in. To vaccinate or not to vaccinate? That's the question on the table tonight. We've got Shawana, you want to jump in?
Yeah, definitely. So this is, as my mom said, this is really a hot topic. I know if it is on my, in my house, on phone calls with girlfriends, with coworkers. I mean, this is truly a hot topic. And just some of the topics that we're going to talk about, our goal is really to just let it all, come out. So like the risks, the benefits of taking the vaccine, children and the vaccine, infection, this COVID passport that they're talking about. So we're going to talk about that as well. If you can go places, without having have taken the vaccine. We're going to talk about how you can protect yourself. We also want to talk about, what are those questions? Like, what are those unanswered questions? Those things that even the scientists have not been able to answer yet. So like I said, what have they done in the past? What are people's concerns? You had the Tuskegee, debacle, many years ago. We know we've grown well past that now, but what do we need to think about with this particular vaccine? And so it's my honor that we have Dr. Michelle Wells on here. And as we said, we have lay people. So you have Alice, my mom, and Terry. And then and my mom's a nurse as well. And then you have Isabella, who's a nurse, ex-military, retired military actually. And they have to take vaccines, and a mom. So we want to just kind of jump right on in. And so probably my first question that I want to ask even the people that are on the call, but also I want to ask everybody on the panel, do you plan to take the vaccine? I'm just gonna come straight out at it. What are your thoughts? Do you plan to take the vaccine?
Yeah.
Well,
I heard
for me, originally, I said no. But then the other thoughts of that is, what if my job requires me to take it or I lose my job? Then what?
Okay. Well, let's jump right there. Okay. I think that's a perfect segue to jump right into this. But I do want to back up to something that Shawana said and kind of address this, the elephant in the room, so to speak. I am a Delta, but no pun intended. In terms of looking at the Tuskegee experiment, okay, and that's the foremost thing that's always on, Black people's minds, African Americans, and that's true because we cannot disregard history. That is something that's there, will always be there. But I think we need to, at this point in time, look at the time in which we're in now. Okay, that was something that was totally inflicted upon us. We have a choice, but the difference between then and now, not only civil rights and all those things, but to look at the fact that we have a seat at the table. Okay, because you have Black or African American doctors such as myself and others who are out there, who are in the sciences, who are in research. They're taking part in this. These things were done at large scale centers, so we weren't only just the participants, Okay, it was a broader range of participants this time. And also, as I said, you have a lot of us who do research and in the forefront of research, who plan and participate in these projects and things. So it's a different ball game at this time, at least from that perspective.
Yes.
Okay,
Awesome.
so that's one thing I definitely want to at least make a lot of people aware of. Okay. I have actually done research in the past, so I do, have a little bit deeper understanding of it from background at doing a summer research at Cornell between my junior, senior year at Hampton University. And then also as part of my training at the National Institutes of Health. So I did have a pretty good research background there. But the difference today is we do have a seat at the table. We are planning these projects, we're participating in them. And so therefore, and then there's a different ethics board now. And then the FDA is over all of these things. So just to kind of segue a little bit, we have to usually write grants, proposals, all those things, put forth the mandate and ideas as to what we're planning to do, how we're planning to do it. We have to be as specific as much as possible in terms of the genders, male, female, etc., being represented, all of our ethnic backgrounds, so that it can be fair, and then we can make a generalized or diverse statement regarding the population.
That's
So
good.
Dr. Michelle,
Yes.
I definitely understand that being a pharmacist, I understand clinical trials and all of that good stuff. But one of the things I have a quick question to you about, which is really good, is, I mean, obviously we know that there are a whole lot of unanswered questions with this particular vaccine, although they've studied it in, almost 70,000 people so far, but it was a short-term type of study. How are you helping your patients that are, now, Pfizer got the,
Approval.
emergency
Approval,
approval. We
yes,
know
an emergency authorization.
emergency- that AstraZeneca, J&J, all of them are going down the same path.
Yes.
So how are you helping your patients be at ease with taking this vaccine that we don't know what the long-term effects are? What we do know is, yes, there's these short-term.
Okay. Well, I mean, we have to look at one or two things. And I know the major distrust, even for me, being a physician, having done science and things like that, because what was being put out to the mass, through the masses, the mass media, and a lot of misinformation, was that we all felt this was more of a government-run project. Okay. And so, and seeing some of the background now that has at least come forward and come out, Pfizer is totally independent, and biotech as a company based in Maryland, they're totally independent of the federal government. AstraZeneca partnered with Oxford, England. Moderna partnered with the National Institutes of Health and Dr. Anthony Fauci. So just as a quick aside, the part where the government came to play with this was this: they had to buy doses of vaccine, and not knowing who would come up with what would be feasible, they said, hey, as long as it's at least 50 to 60% or 50% effective, they were good with it, like something to combat this thing. So the government primarily bought doses of vaccine from each company, not knowing who was going to finish the race first, second, third, or whatever. And we still have at least another 10 or 11 in the pipeline. So that's the one thing I think that will help ease people's minds, and with the truth coming out along those lines. The studies were done. They still have to be done in accordance. They were just done. You had to have all three phases. You had to have thousands of people, so you couldn't just have 500 people and say you had a study. And then you had to be able to repeat the validity of your results. Now, along those lines, so when
But
the difference between these studies and the other studies was the phases were run in parallel. So it wasn't like, you get phase 2 or phase 1, then phase 2, and then go to phase 3. It literally everything happened together at one time. I think
Well,
the
you
benefit
can't
of
go,
these
but
studies was that
you can't
people,
proceed from phase 1 to phase 2. You can't run them in parallel like that because you don't have enough people. So they really had to see phase 1 before they could progress to phase 2. Now they may have shortened the phases a little bit in terms of the duration, was a little of my understanding, but you can't run phase 1, 2, and 3 simultaneously. You can only progress to the next phase if they're not significant enough side effects or adverse reactions.
I think
So
that, yeah,
go ahead.
go, Isabella, great.
So I'm thinking, I like what you said when you said the government paid for so many doses before they were even done. So do you think that made the drug even got to the market faster than it's supposed to be, to get there, because they were already paid for it? And the first person in line is probably gonna get the rest of the payment for the vaccine. So that probably caused shortened phases and probably a faster time to get to the market, to get to the people. I
Well,
personally will not take the vaccine, and that's because I don't think the research is out there for it. But I don't think enough time was spent on the vaccine, and not just the side effects, but with all of these different phase 1, phase 2, phase 3, they still cannot tell what neurological effects it's gonna have on the body. It can't tell none of that. It just tells you that you might end up with flu symptoms, like, and which are all symptoms of a natural cold. So, I mean, it doesn't, I don't think the information that's out there is like normal information. It's nothing to say that I believe for myself that the vaccine was properly done to be placed into people. That's why I'm not taking it.
And one of the great things is that, everybody here and perceive things, differently. And the whole goal is that let's just talk about it and just see, because people have to make a decision themselves based on where they are.
Yeah.
And so they want to make a decision. We're not we're not saying should not. The
Should
whole
not,
question is to vaccinate or not to vaccinate.
Or not to.
And that's the question. Right. And that's the question that everyone have to ask themselves based on information that they get. Then you make that decision. It was a lot of things that came up talking about job, as to whether or not if a job, mandates you. Yes. And we have to talk about that because, there's different laws governing different states, and there are different, decisions on that. But getting back to what Dr. Michelle and also, Shawana and all of them have spoken about, I think that getting back to the research studies, I have worked in research studies or with research studies and various things, whether it was nutritional research, whether it's youth development research, all of those, researches, about behavior changes and things like that. However, we are here at this point, and as it relates to a pandemic and a vaccine versus, who should take it, people got to weigh out, what their risks are and what that means. Yes, I think one of the things in my mind, the long-term effect, what would that be like? And we don't have that now. So, we're just really, thinking about some things that, and talking about some things that people can just kind of work through their mind, and looking at their own personal health, looking at the things that, they're up against, and then they make their decision based on that.
Yeah.
Well, the other thing is this, and I'm not trying to say get it or don't get it. I just want to make sure information's there.
Yes, that's good.
Because everybody has to do what's best for them personally.
Yes.
The other thing of it is, I know that does put a big question in your minds. Like I said, it may have shortened the phases.
Yes.
But it was not wholeheartedly government sponsored, government run. So, it was just a thing of each government, each country paying for enough vaccine once it was developed to get their hands on enough to be able to inoculate and vaccinate their citizens. Okay, to kind of halt this pandemic was one thing. Now, with regards to Terry asking about your job and mandating it, that's going to be a big question on everyone's mind. Now, of course, as we know, truth be told, even with the amount of vaccine that's already been purchased, we're going to have a shortfall sooner rather than later because they could not and did not purchase enough from Pfizer. The government didn't. So, of course, as we know. So the other thing of it is that, we're going to have a shortfall. First phases, of course, are going to be healthcare workers. Okay. And then, and so you're going to have that. Then the second phase is your essential personnel. Of course, your firefighters, et cetera, all those personnel and people 65 and over with different comorbid conditions. That's group 2. Before the general public, in a sense, gets it, we're probably looking at next summer. That'd be my best guess. But of course, I'm not on the advisory panels. I'm not there in charge of any of that. So I think we've got a little bit more time to contemplate some things. Now, as far as the jobs are concerned, okay, I did look into this a little bit. For right now, as far as the COVID vaccine, of course, there are no precedents because no one's gotten the vaccines other than the volunteers and who participate in trials. But there's no mandate that and no law precedents that are set forth at this time that can make an employer mandate you to take a vaccine. You can refuse upon religious grounds, okay, and be protected by the Constitution. But the flu vaccine, however,
I was saying that's not in all states. I think in some states you can use your religious as well as health or what have you, but that's not in all states that people can actually exercise that right.
And it is I believe it is in Georgia.
I believe it is one in Georgia.
Yeah.
I kind of felt like overall, at least in terms of religious preference, you can exercise that, I believe. I was trying to look that up a little bit on yesterday, even to research that. But as I said, there's no precipice or anything like that in the court system right now because COVID vaccine is too new. Now, the only thing that they can be a linchpin, because there is with regards to the influenza vaccine, okay, you can exercise religious preference, but there has been other precedents in the court regarding the influenza vaccine, which is about the closest akin to the COVID vaccine. So they may try to link those two together in terms of refusal, especially if you refuse to get the vaccine and you may either put other people at harm or cause your employer to be sued if they decide to do some contact tracing or something of that nature, and it tracks back to you and then you refuse the vaccine. So, yeah, so although nothing's in stone right now, and that's going to come, but that's one thing, that there is something with the law regarding the influenza vaccine. And like I said, this COVID vaccine is next akin to it because coronavirus is responsible for the common cold and the flu and those sorts of things. It's just a different, more virulent strand right now we're dealing with.
Wow.
So
conversation, anything in the comment, Shawana?
I was watching. I can't even get to it, unfortunately. So somebody else has to look in the comments and see what's going on. So, but I was just saying, I was watching online, and it was ABC News, and one of the things that they were saying was that there's this new app or several apps that are in development right now. I think is one thing from the employer perspective where they may or may not enforce it. It's a whole nother thing with the flights, being able to travel internationally, just even to eventually be able to travel possibly in the US at some point in time if they put in place this COVID passport, and not even just travel. There's some stores right now that are testing this app. Or like I said, a COVID passport to show proof of your vaccine. And they showed on ABC News, they showed on GMA, where the app would have you hold up your mobile phone, and on your phone would show red if you have not taken the vaccine and green if you've taken the vaccine. These apps are actually in the works right now. So that's even to be able to just go into the grocery store, to go into restaurants, to be able to fly on an airplane. So it'll be like your boarding pass, even on an airplane. So this is, and like I said, this is not, they haven't, this obviously hasn't been rolled out yet. This is just things right now that's being tested just so that you could be aware of it. And the other thing to just keep in mind is that, you know, even at some point in time, they said that it'll probably hit like restaurants and things like that first, because they're self-owned, they're not government owned. The government, the local governments and things like that, it probably won't hit them until they'll be one of the last, you know, ones to like really say we're enforcing this rule. But it'll definitely hit these places like flights and planes and stuff like that. And being in with us, all of us traveling internationally all the time, we know with this being a pandemic, unfortunately, that, you know, in order for the vaccine to really to have this herd immunity, you need what, 70 to 80% of the
70%,
globe,
70 to
not even just the
80%. Yeah.
United 70, 80% of the world that gets vaccinated. So there's going to be some mandates, you know, that are going to come. It's just a matter of what is it going to look like. So
Well,
if
I mean,
the government
and watch
starts to
someone
mandate
scream.
this, it'll be
Yes.
interesting. About that.
I know that you
What are your
keep going
thoughts
in and
about
out,
that?
Shawana.
If the government,
Yeah.
I think it'll be interesting, especially with the passports, because I did hear that myself, and whether we're going to get a little separate thing and or a thing that's on your mobile phone. But then I can also see people starting to scream, okay, you're infringing upon my rights. And that's going to become a bigger conversation as this goes forward, whether it's the passport app to get in and out of the country, or even just to fly domestically, but you know, within the 50 United States. That's going to be an issue or whatever, to show whether you have or haven't been vaccinated. Because the minute you say, okay, well, if you can't prove this to me, then you're not flying. Trust me, we're all going to be in a First Amendment, you know, battle in terms of, you know, different things and your freedoms and things of that nature. So it's gonna be very huge in terms of
Yeah,
its far reach.
Yeah, I agree with you, Dr. Michelle. That when I saw that, the same thing I was thinking about is your PHI and HIPAA. I mean, how are you gonna tell somebody? It's still a medical, it's part of your medical records, right? So how are you gonna tell me that before I get on the plane, I have to show you my medical record? Okay, do you wanna know if I have had a flu shot before I get on the plane? No, you only wanna know, did I have COVID?
Yeah.
Did you wanna know if I got something for syphilis if I got on the plane? No, you only wanna know COVID. So that's singling something out. So I'm not sure how exactly that's gonna fly for the airlines without people start complaining about whether it's PHI or whether it falls under HIPAA or, you know, what happens. That would be, because I travel a lot and I'm not getting it. So I guess I probably wouldn't be one of them people traveling.
It's interesting what all is going to come out of this and
Of
how
this, yes.
it's going to really roll out. Because I too agree, that sounds a little bit infringing upon my my rights in terms of my health, because that means that I'm divulging something that I want you to know. So that's not
Right.
You know, we have to look at all of that. Thank you, Shawana, for bringing that out, because you know that's coming, and so people need to know it's coming. I see in the comment, Tiffany McCall said, "No, I will not take the vaccine." So you're gonna have a lot of that, you know.
We are gonna, yeah, we're gonna expect a lot of that, because
Yeah.
right now the most recent polls show, you know, like 6 out of 10 Americans, 60% right there, so they're not going to get the vaccine. At least 4 in 10 or 40% of the African American population, Black population, so they're not getting the vaccine. Unfortunate in one way, because this is something that is going to be protective. Right now, with the leading candidates between Pfizer, Moderna, and then when AstraZeneca is able to come out, all of their vaccines are 2 shots within Pfizer 21 days, Moderna within 28 days. So within a 3-week time span, you have to have both shots to have maximum efficacy or effectiveness up to 95%, as they're boasting for this. Johnson & Johnson, when it's able to come forth, they are 1 injection. Okay. Now, the odd thing with AstraZeneca that I read, you get the first injection, you have higher immunity. Then the second one, it dropped them back, but it kept them above like 65, 62 to 65%, which still, meets the threshold the government set forth. But we also have to think of not only ourselves, but think of our loved ones. And we, unfortunately, as Black people, we have a lot of these comorbid conditions: high blood pressure, diabetes, COPD, heart disease, things that are putting us at higher risk for COVID and higher risk of death from COVID. So sometimes, we kind of, if the biggest thing that comes out of this, or the worst thing that happens to me, is I get a sore arm, little muscle ache, feverish feeling, whatever, for 24 hours or less, and the next day I'm perfectly fine, then it's going to be helpful, and we can kind of, as I say, get back to normal. But I'm at least trying to help protect relative, friend, and family.
Yeah, it just
But we're
depends
not
on whether
sure. But
you want.
we're not sure that's all that comes out of it. That's the
Well,
Right.
no,
thing.
we don't.
So
We
that's
don't know
the
all the side effects. We
So-
know these are the biggest. These are the biggest. But when I look at what's happening to people with COVID right now, when you look at the infection, illness now, especially those who've been severe, these people developing blood clots out of nowhere, have no history whatsoever of pulmonary embolism, like clots to the lung, clots in the leg, using heavier and higher doses of heparin and blood thinners to even combat this, because it makes everything more hypercoagulable, or blood cells stick together more. So you're getting that problem. You're getting more heart attacks, more strokes, more neurologic things that are coming out from having this illness. And as we've seen, we're what, 300,000 plus in deaths at this point.
Yes.
So I mean, it's a lot that we have to weigh. So the illness itself, sometimes, is the vaccine going to be as bad as that? Most likely not. The people, at least the two reported people right now in Britain who've had the most trouble, were people with severe and significant allergies that they walk around with the EpiPen.
Wow.
And they probably should have been a little bit more cautious in the very beginning, with regards to the vaccine. The other thing I wanted to bring out now, the flu vaccine. Okay, great. It has been studied and has been around for years, but I'm sure that first one, they didn't know everything about that first initial vaccine either, and people took it. The second thing is that vaccine is a live vaccine. So we have part of the actual flu strain going into your body. Okay, they have live and they have the kill vaccine, etc. Now with COVID, with this vaccine, there's no part of the COVID structure that goes into your body. They have analyzed the virus or what have you, and that's M spike in particular, and isolated. Okay, the DNA, et cetera. So this is made from what we call messenger RNA, which tells our bodies how to make a protein or antibody to fight this thing off. But there's no part of COVID that will enter our bodies from this vaccine.
Oh.
So that's another thing that people have to realize. There's nothing COVID here going into you. They studied it, analyzed it, copied that sequence, and now they've been able to extrapolate and make this rapidly. And because they used mRNA, that's why it was a faster process than the usual ways of making vaccines.
Wow. That's good to
Isn't this
know.
Dr. Isn't this the first like major
Yes,
um
drug.
Yes,
like they use mRNA, the first
yes.
one that they do it and that they're doing it in masses right now?
Mhm.
Yes.
It is
So
for
we're
Pfizer
so
and for Moderna. This is the first one that anyone's doing.
that's why I
Oh.
think there's still unanswered questions, that because to your point, messenger RNA studies have been, it's been years, but as of late is when it really just kind of like have taken off, and this being the first drug, if you will, in the masses that is actually being put in human bodies. So that's why I think some of the unanswered questions are, can it help people that have already had COVID? Can you still spread after being vaccinated? And then how long do you have protective immunity? With the
Mm.
flu
Right.
vaccine, that's
Mhm.
annual. how long, and obviously you get your second dose, at least with Moderna and Pfizer and AstraZeneca. Don't know what the other ones, with the exception of J&J being one vaccine. But then what is the protection? How long will, those it's last before you have to get another vaccine? Is it, 6 months? Is it 1 year? Is it 5 years? What is that protection? Nobody knows those answers just yet, and that won't come, obviously until it's been studied or is documented.
Yeah, and if you have to get this vaccine each year, like you get the flu vaccine, so that's the other question: is this a yearly vaccine that we got to get, or is this a vaccine that
right now? Yeah, I don't think anyone has completely answered that question. The one thing that I have seen, heard, and read was that if you've had COVID infection or COVID positivity, that you should still get the vaccine.
Wow.
Because we have seen people who have had COVID, and then they have had a second or reinfection with COVID. And so therefore they are asking that people, if you've tested positive or you've actually had COVID infection, and there are at least 7 different syndromes of this and presentations, not just your cough, your shortness of breath, some are getting diarrhea, some with the loss of taste, loss of smell. So there's 7 different varieties in which, or presentations in which this is coming forth. So they're telling people, hey, look, if you've had COVID infection or if you have tested positive, please get the vaccine. As for right now, the second shot is acting as a booster to increase your immunity. And so as the participants in the study, and this is where these questions are going to be answered in the coming months or so, even in the year, because I'm sure of course, these people are part of a huge registry. They're going to retest them probably in 3 to 6 months and test like we do for example, hepatitis. Okay, those of us in the healthcare field, I remember in med school, I couldn't even go to my second year going to clinicals because we had to be vaccinated for hepatitis and get the sequence of shots, 3 injections. And then after so many months, we had our blood drawn to test our immunity. And if your immunity level was not there, guess what? You got another shot. And so we couldn't even hit the floor to do anything, to learn anything clinical until. So I'm certainly thinking, okay, that the participants are at some point in time going to have a couple months down the road, have blood work done to check their immunity status at various times during the year to see whether this has to be an annual vaccine or something we'll do in 2 years or 5 years, like you do your pneumonia vaccines, etc. So some of those things will play out, and they're going to follow these people, so we'll know some of the long-term data.
So Dr. Michelle, I got a question right quick. So since the people
I'm on the hot seat. Yes, ma'am.
because you're right there, you're right in the midst of it. All of us, I like to read, so I read a lot of journals and all of that stuff. So most of my information comes from reading, not the news, because I'm not paying attention to the news. There's nothing going on in there. But like reading the journals, the studies that's out there on that stuff. And my question for you, as you said earlier on, they've discovered that some people that already had COVID is getting COVID again. So how are we so sure that when you get vaccinated, you cannot still get the COVID? Especially because it's not the real COVID going inside of you. It's some kind of messenger RNA that's kind of copying the DNA of the COVID that's supposed to get you sick. So I think if someone who's been infected gets the COVID again, I just believe that when you get the vaccine, you might still get the COVID again.
Well,
and we know,
God,
we know it's mutating. I was saying,
we
know it's mutating.
Like the flu.
So
yes, but it has mutated, and that's why you have the 7 syndromes. Exactly.
So my thing is, what about, thank you, Isabella, that was great. What about, children, teenagers or someone that's asymptomatic and you've gotten the flu shot, you've gotten the vaccine and you could get reinfected. It's just kind of.
Right. Well, the thing of it is they don't know, okay? The big thing is this. Right now, the vaccine is for people that are 16 and over. Okay. 16 and over has not been studied in children. I think they're starting to undertake that now because as you saw, children were being infected with COVID and they were coming down with what I would term the equivalent of Kawasaki disease, where all their blood vessels and things were attacked, et cetera. And that's a horrible thing. I've seen one child with it and he did survive. So children so far, they have not gone that far, but they are looking into that in terms of their vaccine, but 16 and over. As far as COVID persons getting reinfected, again, we don't know what these people's comorbidities were, or if they were just healthy adults, you know, kind of like us, et cetera. And the immunity just didn't build up or wasn't sustainable. With the vaccine, you know, again, that'll be a long-term thing of following all those participants in the trials to give us better answers as this goes along. You know, it's kind of like the flu shot. I've heard people anecdotally say, "Oh, I took the flu shot. Man, I came down with the flu." Well, you know, or you take the flu shot, you may get the flu, but it's not as severe. It's kind of like Zicam and some other coldies and other products on the market that shorten the duration of the symptoms. So nothing's 100%. You know, so the best
they said it was 95%,
but it's 95%.
That's very high.
That's very high. It's 95% effective. That's awesome. Well, the government set the bar low, said, hey, if we can get something 50% effective, you know, we're doing great. You know, I'm like, wow, we're lowballing this thing here. But the thing was, we wanted to, you know, they wanted to try to have something to combat this. And so, again, like I said, nothing's 100%. We're still going to, I don't care, vaccine or no vaccine, we're going to have to do what we're doing now. Frequent hand washing, social distance, 6 feet, keep your groups and gatherings very small, intimate family members, etc. But then also the mask. And this thing, it drives me crazy to see people, and I'm supposed to bring one over. You got your mask on, it's a chin strap.
No, exactly.
I can't stand that.
It's a chin strap. It's just it's a mouth guard. And so my thing is, but you're still inhaling. Or you've got it up here, but yet it's barely at the tip of your nose. Or if it does cover, you don't fold the little metal strip down to form some adherence. So then you're still inhaling everything through the top of the mask. Or, you know, you're twisting it up and looped over the ears, and you got these pockets on the side. Put the mask on, right? That is
wear the mask.
Thing.
You know,
Please,
it just
wear the mask and then make it adhere and conform. I know it's hard with glasses. I've heard several crazy remedies to help you, you know, wash them soap and water before you put them on and put your mask on, you know, do this, do that. I don't know what the answer to that is because I do wear glasses at times with the mask and it causes a problem. But please, the tighter it is to your nose and your face here in the bridge and to your cheeks and under your chin, the better. Because you're not letting any particles escape and you're certainly not letting anything, you're not trying to breathe as much in. So please wear the mask appropriately. That is my biggest.
I'm with you on that. I agree. Mask wearing, you know, because, you know, people, the chin, or they got it down. I had to learn myself to put the mask on and put my glasses over the mask. I mash it down, put my glasses over it, and I don't get that, you know, sweat or whatever. So I just think that you got to work it. This is what we have right now. This is what we got to do to protect ourselves and to protect others. And the best thing, you said it best, you know, we just got to educate ourselves. And there's something that, you know, I think all of us are feeling the same thing as it relates to the mask. But if this is what's going to help, you know, going to protect my safety as well as others, then I'm willing to do that. This is what we have to get, you know, take the vaccine or not. It's your decision. And based on information that you have, and that's what we try to provide, is to educate and just put the information out there. Shawana, great job in terms of you know, putting some of the things out on the table and asking the questions. And Dr. Michelle, thank you so much. This has been really powerful. as well as Isabella. I want to talk about, oh, Shawana, look like you want to say something. Go for it.
Please.
Yeah, we have some comments in the chat. So Derek said, very informative. He hoped this is being recorded, and it is, and we'll make sure it's posted. And he said, thanks for educating us. And then Glory, not the mask. He's convicted of the Chingard.
I'm convicted.
But I wanted to see if Terry, if you had some comments or some questions, because we've been chatting. But I know you have had some comments and questions, and you're really passionate about this too. Unmute yourself.
And trust me, I'm no way the foremost authority on this stuff at all. Please.
No, but you've been great.
No,
You've been great.
that's why it's just a discussion among ourselves.
Right.
Just
We're
a
not telling-
discussion.
I was not in the
Right.
research, so I'm not telling anybody to or not to take it. You know, you have to go do your research, read your journals, take a piece of paper, put your pros, put your cons, and see
Right.
what it is that is best for you and your family. By no means our conversation is telling anyone exactly what to do about it.
That's our disclaimer.
That's our disclaimer.
That's right. No, you do have to consult with your physician and talk with them.
Right.
I mean, because you know
Yeah.
your health status and situation. They
Yeah.
know, and then you all can have a discussion. I'm sure it'll be spirited at best.
Yeah.
You know, but I mean, those are things that you have to bring to your physician and weigh the pros and cons, et cetera. And they can certainly, hopefully, help you understand a lot better and go forward, you know, from that perspective. You know, and I think that's the thing. But I think some of the biggest things that are preventing us as a people from going forward, of course, again, going back to the Tuskegee experiment, the Mississippi hysterectomies without your consent, you know, even look at things like Henrietta Lacks' story, you know, where, you know, she was never informed, no consent obtained, and then they're, you know, using her cells, you know, to fight cancer and fight many
Yeah,
things.
that's right.
And so we have to be, you know, keep and be mindful of those things, but then also realize that we're in a little bit different time, a little bit different day, and we have at least moved forward. And we do have a seat at the table. So that, you know, those are things to keep in mind. And if it's going to help you, family members, or someone else, you know, it's something to think about.
Now, there was something, and I don't know whether this is true or not. Terry, either one of you has something?
I'm good. I'm good.
Somebody.
I was looking at the chats as well, but I'm good. I don't have anything.
Someone said that, you know, for one of the, you know, a couple of people have gotten the vaccine. I don't know how quick that, because I thought they just started administering it last week, but that they got Bell palsy. And I'm not sure whether or not this is, you know, some things I think that,
Wow.
Shawana, go. 4?
I read that one of the study participants got that with the AstraZeneca vaccine. But as far as right now, Pfizer just got approval on Thursday or Friday. And so it was shipped out. And so there shouldn't be anybody vaccinated until either tomorrow or Tuesday at the earliest.
Right.
With the new
Because
vaccine.
the only one person or maybe two that was in Europe. One of the elderly lady was the first one that got so I don't know about the 4 Shawana's
doing okay as far as we know. Yeah.
Y'all hear me, or am I going in and out?
You're going in and out.
Going in and out.
A little bit.
Okay, well, 4 people from the Pfizer study came down with Bell's palsy, and they are studying those people to see what's going on. One person came down with it, you know, probably a couple of days after getting the vaccine. One of the other people came down with it 48 days later. But nevertheless, there were 4 people did come down with it. So they are going to be reviewing, you know, safety. That's the CDC. They have a immunization safety office, and they're the ones that identifies, you know, the vaccine side effects, and they conduct their various studies, you know, to determine if there are any health problems related to vaccines. So we know that they are going to do their due diligence on this. which is really good. But nevertheless, there were 4 that came. It was below general population. So right now it's not a concern unless there are more, that starts bubbling up to the top. But we won't know until it gets into the millions of people. You really won't know until you see it in these millions of people before you really know like what issues are really associated with the vaccine versus what's associated with a person's just general health. So more to come on that.
So those were people that was actually in the research study,
Run
the
study,
trial,
yeah.
the clinical
The
trial.
trial.
Yeah, and I have participated over the years in different clinical trials. So I'm one of those that, sometimes I'll jump in something, but I think that, overall, yes. I think overall, Dr. Michelle,
the
right?
real truth. Renee said the real truth is never revealed to the public.
Correct. No, let me stop.
Well, let me say this. One, you never know the entire thing. I don't care what you're dealing with. You never know the entire thing. I don't care what you're dealing with. But the other issue is this. We have to look at, you've got a lot of scientists, and we're talking multi-billion-dollar companies with a lot on the line. Okay. And so for them to come forth and present falsehoods and factitious statements will be very detrimental to them, because those are lawsuits waiting to happen at that instance. 2, you have another, no matter what they did or the research, they have now had foremost authorities and leading authorities who do nothing but look at research at the FDA, and that's the governing body. And if it does not add up, okay, 1 and 1 don't make 2, or you're telling me apples and oranges, and you say, oh, but we're going to end up with an apple pie. No, that's not going to work. So they had to review the safety data. They had to review the whole entire process of what was done, how it was done. So there was still some regulation along the way from each phase, from phase 1, 2, and 3 of those trials. And then the full presentation of all the data went forth on Thursday to the approval boards. So they were doing this Thursday and Friday. And so despite his best attempts, oh, get this done or you lose your job, he can't direct or command any of that.
Yeah,
he can't, because that's why I said that misinformation, that falsehood, that fake news, as you have it, those are things that he does and is still doing to this day. And we're not going to get into a political segue about this, but people aren't jumping to your tune because there's too much at stake. Okay, so I would say I hope that we do have a little bit of comfort in that. We have governing bodies to take a look at that, to research, review all of this data, and this is their job. This is what they do. And so if they do faulty work, then there are millions of people that are going to be held accountable within the governmental body as well as these corporations. And that's a lot of liability. And trust me, I don't think they want any of that.
And I tell you what, we do not want another 300,000 people dying. We just, we don't want that. So just weigh that. We do not want that to happen. And based upon that, I think that people can make, their decision about what it is that, they want to do, but we just don't want that to happen. Right. So we got about another 10 minutes because we did a whole hour this time, so we can still conversate. Yes.
Any other questions out there that any of us can answer?
She said any of us.
Well, I mean, from a pharmacist perspective as well, or nursing perspective, because we're going to be on the front lines. I mean, CVS and Walgreens are going to have to administer this thing. So people are going to come and look to you and say, hey, well, look, because right now you've got your, again, healthcare workers and your long-term care facility, your nursing home and skilled nursing facility patients, as well as staff, are going to be vaccinated.
Like Isabella and I retired, right? Isabella, we're not coming out of retirement.
No, I'm still a nurse. I'm not retired, but I'm not working as a nurse. I'm not working as a nurse right now. So I'm thankful for that, because I know if I was probably still working as a nurse, And in the military, it will probably be mandatory for us to take it. It was kind of like we
Yeah, it was
usually the first to
mandatory
be
for us to
mandatory
take
to
it
take
too.
whatever.
Yeah, when I was nursing,
but
I had to take it too.
I think for me, it's not that I will never take the vaccine. I
Me
just
either.
want to wait. So I will wait.
That's
I'm
who
one of
I
those
am.
people that's gonna wait. And I'm a very healthy person. So, you know, maybe my body, I have no comorbidities, none of that stuff. So I believe if I get it, my body will be able to fight it. So I'm not on a rush to get the vaccine. I need the research to back up the vaccine for me. So I'll be one of the people waiting until it's mandated. Then I don't have a choice, but I'll be one of those people waiting to see the results that come out from the first year of the people that take it. By then they should have some good information to, you know, whether it causes infertility or, you know, neurological problems or whatever it causes. So I'm just gonna wait. So
But just
I don't want
realize,
anyone to be influenced by me not taking it. Make a choice of your own. I'm gonna wait. I might take it in the future, about 2 years from now.
okay, but just
All right.
realize healthy people have gotten and come down with COVID and they have died. So
Yes, that too.
I mean,
Yeah,
there's
that
nothing
too. Yeah, that
100%.
too.
And I'm
I
not
heard that
trying
just-
to trust me. I'm not wishing a thing on anybody. I pray that we all stay
I
healthy
heard
and
that
we
just
stay well.
recently. Yeah,
Yeah,
a
but I
healthy
take my
person. I
chances.
heard that.
Yeah.
Yeah.
Yeah,
Just
several,
recently, a healthy
know.
person died. Yeah.
several people, you know, are part of that 300,000 at this point. So, you know, we would hope that we'd be able to better fight off a disease, but there's no guarantee.
There you
Right.
go.
It's not.
And you might find
All right.
actually when you get the disease, you might find out that you do have some problems that you never knew you had. Right?
Yeah,
New thing about
exactly.
it,
Exactly. Terry, did you have something?
No.
Okay, who was that? Shawana? Shawana.
Terry's like, I'm soaking this in.
Yes.
Covington, she said, we are praying. Renee said, and these people that died, I guess they were wearing masks too, and they still died.
Some didn't, some didn't.
Oh, look, what was that? Derek said, Jesus' blood is in that corner.
Amen. We do ask for his blood covering, but just some wore masks and some didn't.
At this point, it's nothing but the blood. That's all we need.
That's what it is.
Yes.
My comment though is the logistics of this whole thing. So I'm thinking logistical now. And so I want to transition the conversation real quick. So now you have to vaccinate a lot of people, and they're going to be putting up, I'm a part of the Medical Reserve Corps. And so they're going to be putting up pods all over the place, you know, to start vaccinating people, especially when more doses come in. So how, as a nation and even as the world, with all these millions of people on the earth that are going to be getting vaccinated, what does that that documentation look like? Especially if you're the person that has to take 2 doses, 2 shots, how do they just keep track of all of that, making sure that you're not getting the Moderna vaccine and you got the Pfizer vaccine first?
Oh my goodness.
You're not supposed to. So I'm very curious of what kind of plan have they put in place to really ensure, because it's not like people are going to always be going to their doctors for this. You're going to have people in health clinics, like I said, going to pods all over the place. So what is
Going to
that?
CVS,
I'm sure they're going to request or ask that you
have a
return
database.
to either your physician or wherever you took the first vaccine. And those people, because they have a database, they've got to keep this logistically in a database. So if you got it at CVS on Rome Street, you best go back in 3 weeks, CVS on Rome Street. And I'm sure that they're going to also put out phone calls as reminders like they do when your medication, et cetera, is ready, so that we can keep track and you get the same vaccine. So there won't be any cross variation in what you're receiving. There was one little, as I say, conspiracy that I heard about, there's a microchip being implanted in this vaccine.
Yeah, because we've heard that. Let's get on with it.
And we're tracking. And I gotta get to this one.
DNA changing.
Right. There's no DNA changing because they're using messenger RNA to create a protein, an antibody to this so that we can fight this. There is no tracking chip. Now, Bill and Melinda Gates, Dolly Parton. So we're going to have a country and Western Gene pop up now because she's donated money to
I'll take
further
the Dolly
vaccine
part of it, Jen.
research. So, so if everybody wants to talk about a tracker, look at what's in your hand. This right here is your
Yeah,
biggest
right.
tracking device ever.
Exactly.
They track everything everywhere you go. Your sleep, they can hear you snoring. And so that's a huge microchip and a huge undertaking to break it in such little pieces, liquefy, get it in you, and then track you. Your phone is your biggest tracking device. And that's your tracker. So because most people don't turn the location settings off. But in any case, so I mean, all in fun and all in truth though. So there's a huge database because they've got to keep track of the volunteers. They've got to keep track of, okay, this person got this dose on this day. They're giving you a card. And as I said, they probably developed or have, internally developed some system to alert you at least, a couple days or a week in advance. Hey, you got to come in on this day to get your second dose of your vaccine, for COVID, et cetera, et cetera. So I know there's some sort of internal tracking or whatever that's going to be in place for CVS, Walgreens, or whoever administers.
I've heard that they have hired with CVS and with Walgreens, they have hired thousands of people for this vaccine, and distribution of this vaccine and the tracking. So I've heard that.
Yes.
Yes.
And
So
UPS and
all
FedEx
these
are
different-
being very diligent, so your Christmas packages might be a little delayed because they're trying to get vaccine
So
out.
all
Right
these
now,
different-
California, Illinois, New York, it was like 4 or 5 places that have heavily populated states first are getting the doses by tomorrow and delayed to Tuesday for administration. So we're in Georgia, a little bit longer.
So part of what Shawana was saying also is, does all these different places and all these different areas, do they have a central point, let's say to Pfizer, that they send all that information so that information can be analyzed? Because we could have information at 10 different CVS, but if nobody takes those information and bring them together, it's just information just sitting there. So we could record it as many times as we want. So is there somewhere that all that information from CVS, Walgreens, and all these different places are gonna land in a central point?
Right. I truly suspect that all that's been worked out. So that, say, for instance, again, if you get to CVS
safety
here,
reasons too.
and for safety reasons, exactly. They've still got to be able to track you. So let's say, for instance, if I got the Pfizer vaccine and I've gotten both doses, that data is entered in terms of the lot number, like when they give you your flu shot. They've got, each one has identification, a lot numbers, serial numbers, all this other stuff. So they can track and say, okay, you received this vaccine on this date. I start having issues and problems. I can report back to them. They report back to the FDA and the safety board as well as Pfizer. And so all those things do come forth. So I know that there is certainly, whether it goes to Pfizer, the other goes to Moderna, et cetera, there's going to be a way to track and keep all that data input as to who got what, when, and where.
Awesome. Ladies. All right.
Yeah, I was saying it's got to be a database somewhere. Renee said maybe there's an algorithm system set up somewhere.
Yeah.
And she's right. So we don't know the background behind all of that, but Mom, I'll turn it over to you. That's all we had regarding.
Wow.
That's
a lot of information. Thank you. I see Keisha Boykin said thank you for this information. Knowledge is power.
Amen.
Research.
And the lack of it is ignorance.
Yep.
So you want to have the knowledge so that you can make the decision for yourself. We're so excited that all of you, joined with us. Dr. Michelle, can't thank you enough. You've enlightened us. You've educated us, and especially me. And thank you for that wealth of information. Thank you, Isabella, for sharing information and asking great questions too. And Shawana, thank you from a pharmacist perspective. And Terry, just listening in and taking it all in, because you have to share this with our families and with those who we come in contact with, church, whoever, friends. You will have some information that you can share. And then we like for you to share the video for everyone that's out there. Share the video. It's great information. You definitely enjoy it. Please join us again. This is an ongoing conversation. We'll probably have to pull this back together again. but it is ongoing. Let's talk about it. It's ongoing. Next week is going to be awesome because we're going to be talking with the millennials. How about that? And Generation Z, Generation X, and the baby boomers. But it's going to be really exciting, really great. So let's talk about it and just have a great evening. Anyone else have any last words?
I just want to say thank you all for having me. It's been my pleasure. You definitely kept me on my toes. And God told you to be also ready at all times. So I just have a quick question. Terry, have you made up your mind one way or the other now since the discussion as to whether you're going to get the vaccine? You think you're closer to making the decision? I'm just curious.
You're on mute, Terry.
You're on mute. You're on mute. We can't hear you. You're on mute. You're on mute. Okay.
Okay. I've never even taken a flu shot, and my doctor advised me to take the flu shot. So, and I'm kind of nervous about that. But as it relates to taking that one, not at this point. Now, it may be a different story if it depends on my job, whether they make us, but it just depends.
Yeah.
But I'm glad I got a lot of good information, so now I know.
Right. That's good.
Mhm.
That's good. Interestingly enough, not one of my children, all four, one of them had taken the flu shot.
None of us have.
I take it every year, but that's me. I take it every year. But each to his own. No matter.
Well, I felt like because I remember you taking it 1 year, you still got the flu, so I was like, no, it's stupid. And they told me put the flu in you.
As a matter of fact, I believe I had the corona back in December. And I'm serious. This was just before Christmas. I took the flu shot in November and October. And in December before Christmas, I was messed up, couldn't breathe. It was just horrible.
And it may well have been. And people did not realize last November and December that this is what it was. And they were passing it off as a flu, but it was much more severe and virulent. And so, and then it got the opportunity to mutate.
January 1st for me, I was diagnosed with January 2nd, I was diagnosed with bronchitis. Yeah. And it seemed like it could have been the coronavirus when I thought about it.
May have been Rona. It may have been because like I said, it takes on various different forms. So it has been a cold and cough, it's been the flu, those sorts of things. So it's hard. So many of us have probably already been exposed and had either a mild case of it or been totally asymptomatic. But because we're not really sure, we've passed it on to other people before they start saying, oh, wear a mask, do this, do that. And so again, we've got to stick to the simple things. Even if we get the vaccine, you've still got to social distance, wash your hands, wear your mask, all those things. Oh, and wearing a face shield in and of itself is not protective because I'm sorry, that face shield is not all encompassing and all enclosing. You got plenty of air and ventilation going through.
Well, a doctor that I know, she was wearing a face shield and she worked with, she's a pediatric doctor and she ended up with it and her son. And she wore a face shield.
Now, because the face shield is not effective. It's not effective.
But without the mask, it's not going to be effective. It's not effective. Inhaling and breathing in everything that there is.
On the sides. Yeah.
Right.
Well, look at what they're saying. They're saying that these the plastic, what do you call it?
These face shield
barriers.
No, with the store in the store.
Oh, in the store.
The plexiglass.
Now they're saying that that's not even safe. It's coming over and around. I just heard that on the news. I don't know whether fake news or not, but they're saying that too.
Nothing is safe. Nobody's safe.
Unless you're walking in a bubble. Okay, it's not going to be 100% because there's going to be ventilation and things of that nature.
Right.
And so that's where the mask is going to come in, and how we wear this thing appropriately is going to be the key. This is what's preventing and decreasing the inhalation and the spread of this virus.
Right.
So we
Yeah.
still got the mask up, vaccine or
Mask
no
up.
vaccine.
That's all we
Vaccine or
can
not.
say is
Put the
mask
mask
up.
on.
We're-
Mhm.
Ladies, we'll love to. Did you have something to say, Shawana?
No, I was saying, wash your hands, wear your
Wash
mask.
hands.
I tell you what, my hands be so sanitized until I got different smells. of
Mine's
that.
dried out.
They dry
know,
out,
I
they will
know.
break out, they'll peel,
Mhm.
yes.
But my thing is, here goes, always thinking with all of the sanitizers and that that's going in and you're inhaling all of that, what's going to be the repercussion behind all of that going into your lungs and stuff?
Ooh.
I think about things like that.
I'm not
Okay.
inhaling, I mean,
Why
I'm
is
gonna rub
this
my hands, and then when I get
Why-
in some hot, nothing beats hot soap and water for me
There
all
it is.
day, any day, all day.
I do
So
more
this is
soap
a
and water.
temporary fix, and I'm not sitting there sniffing them, so I'm not
Yeah.
worried too much about that. And I've got the mask and I keep going. But hot soap and water, nothing beats it.
That's right.
Listen,
Mama, how you
Listen.
inhaling the hand sanitizer? How
I
that
know, but when I bought this kind that's supposed to be raw
Put it
something.
on. Mask
Yeah,
up.
and then just
We should all put our
on and
mask on.
press
Wear your
the
mask on.
nose. Make sure it's secure.
I
Boom.
put that on when I put my
there
hand
you go.
sanitizer on.
That's
Okay.
perfect.
Thank you.
My
Listen,
vaccine.
this has been so much
I gotta
fun.
do
This is
that.
really, really fun.
Boom.
Thank you so much. We normally don't go this long,
Perfect.
but we just thought that it was good to
Let
do
me
this
stop.
tonight, just to give the information out. Dr. Michelle, I just can't thank you enough. Isabella,
Thank
can't
you
thank
all.
you
This has
enough.
been entertaining and informative, so
And
I
informative.
appreciate it. Yes.
All right, listen,
right.
let's talk about it, pass it along, get someone to, just pass it to others and join us next week, 5:30, same time. And this is the Sunday before Christmas. So we'll probably have Christmas music and everything going and have our millennials on. And that's going to be on and popping. So we want you to join in. Join in. And anytime you want to come back, just come back. Say, hey, I want to get back on that show. It's okay. Get back on. Okay. Thank you so much. God bless everyone.
God bless.
Take care as we go out with our music.
All right.
Let's talk about the conversation.
Amen. Stay safe,
All
everyone.
righty.
Thank you.
Bye-bye.
God bless
Be
everyone.
blessed.
Alrighty.
All right. Bye-bye.
All
Bye-bye.
right. Stay safe
Thank
on the front
you.
line, Dr. Michelle.
Everybody stay safe.
Awesome. So we
Okay,
got
bye-bye.
awesome. Somebody said it was awesome.